So what is family medicine? It is an internationally recognized nomenclature name for the discipline, knowledge, domain, and medical specialty of all primary care doctors. So every single term is important. And this definition comes from a textbook of family medicine, not something off the top of my head. It came originally from the historic tradition of general practice. So people who are the original family doctors, the GPs of the past, the GPs that are based in US, in UK, and similar countries. This comes from there. It's a specialty which is concerned in providing comprehensive care all around to people, their families, and put into that everything that's going on in their body, everything that's going on in their mind, and around the social sciences too. And the scope of practice is very big. It covers all organs. It's not limited by only this organ that you've done a specialization or a super specialization in. You basically have to do a specialization in everything. Excuse me. It covers all genders. So it's not like I'm only going to see men or only women. We actually even incorporate transgenders. Sometimes transgenders or people who don't identify with any gender, they might wonder, do I go to a gynecologist or do I go to an andrologist? I don't know what to do. We are there for them also. We see all age groups. Pediatrics, we do specialization in geriatrics like I've done myself, and everything in between. So everything is covered. The scope is huge. Your patient base is going to be unlimited. So how did it evolve? What is the historical evaluation of it? It actually developed as a counter to the phenomenon of rapid fragmentation of medical care. So these days, all students keep on asking me is, after MBBS, what do I specialize in? Of course, you will specialize, but why go narrow? There's a broad specialization also. So this is to counter that. And this started after World War II. So it's not there only in our country, it's everywhere. Everyone wants to be a specialist and a super specialist. Let's see what we are. Let's see which category we fall in. So in most countries, they are the first point of contact. In India, you do manage to walk into a specialist or a super specialist office or a clinic without really knowing if that was the correct specialist for you. What we do is we kind of filter you out and triage you and start your treatment. And then if you need a specialist or a super specialist, we will send you to the right place. So that's how we work as gatekeepers sometimes. And this way, the tertiary care facilities, which are so important but so overburdened, those can be structured better and the right patient reaches the right place. So they are the backbone. They're actually the backbone of any healthcare delivery system. It can be one of those private insurance-based systems that we have in the US, or a public funded one like in the NHS in UK. Now, many people would wonder, then how is family medicine different than community medicine? Is it the same? Do we only take care of preventive health? So community medicine doctors, I've got many friends in them who are also family physicians, many colleagues, many of my community medicine friends, they work with WHO. So they're important. They're very important, and we work with them, but we are not the exact same thing. So because there aren't enough, some people might confuse us and wonder if preventive and social health, or PSM, that we have in our curriculum, or CM that we have in our curriculum, is that the same thing or not? Unfortunately, we don't have family medicine as a subject yet, but very soon I believe we're going to have them everywhere. So in reality, they are not fully equipped to provide proper disease care. An MBBS degree prepares us. Of course it does. And if you have interest and you work with the right people, your MBBS degree with your experience can help you become a good family physician. But it's always better to have some PG training in the correct side. So the bigger responsibility of the community medicine specialist is to supervise the determinants of health, make sure the policies are made correctly and they reach the government, and from there it percolates down to the individual. So the basic needs need to be made available and accessible to everyone via these community medicine specialists. we all have to work in close cooperation with each other. So it's not like I'm better, they're better. We're all good. We're all the best. We just need to be there for each other. So the family medicine, me, us. It is a primary, continuing, and personal physician. Again, a textbook definition. So people who are studying family medicine already, who have studied family medicine, or who are planning to study, this is going to come up in your textbook. What is a family physician? Someone who provides primary and continuing care to the entire family inside the communities, address the physical, psychological, and social problems, make sure that comprehensive health care is coordinated with the other specialists as and when required. Sorry. Yeah. What are our roles? Our role is to maintain health, physical, mental, in the defined population, in the individual, in the families. We should be directly accessible for all kinds of illness. And we need to take the responsibility to be there for our patients. That doesn't mean that you have to be 24/7 on your phone, 24/7 available and always answer, but somehow you need to make sure that the families who are with you, they know how to get in touch with you. They know what to do in case there's an emergency, and you are there to bring all their healthcare needs together. The detection of the earliest departure. So if we are there for a really long time with a group of families, we kind of can identify very quickly if something is a little different, because there is no, in my definition, in my mind, there is no normal. Everyone is unique. So if you know your family's or your patient's unique characters, then you will be able to identify the aberrations from that sooner and send them to the right person. So the long-term management of patients in the setting of the family and the community, that is our role, that's our responsibility, that's what we do.